So, you're the kind of person who likes to help other people, and you want to make a helping profession your career. There are several great options, but the differences between them can be a little confusing. Maybe school counseling seems like a good fit for you. But what about school psychology? And what's the difference between them anyhow? On the other hand, how about clinical mental health counseling? Or would applied behavior analysis be a better choice for you? Let us help you break it down. If you think you'd like to work in a school setting and you want some variety, working with individuals at times, with groups at others, and you like helping students and teachers take proactive steps to prevent problems, along with helping students select the right classes or colleges, school counseling might be the right choice for you.
I think in being a school counselor, you really want to have this desire to listen to others, really care about these students, and focus more kind of the personal social issues that a student is struggling with. Seeing students individually, running groups, doing classroom guidance lessons, doing prevention programming. School counselors also deal a lot with academic advising. If you're in the high school, you'll be doing college planning, and college advising is a key part of your role as well. And I think that's one of the unique aspects of the school counselor. You do have so many different roles in the school, not just the individual work.
On the other hand, maybe you enjoy testing and analysis, observing classroom behaviors, and developing plans to help students with special needs like learning or behavioral disorders. You're a more analytical thinker. If so, school psychology might be the best fit for you.
The person who's great for the field of school psychology is someone who likes to work with numbers, who likes to write, and is a people person. We look at children who are having learning and behavioral disorders. We try to figure out how best we can structure the environment to help those students be successful.
It can be anything you want it to be in here, Noah.
Okay. I chose school psychology because I want to go into schools and be that person that can be there for kids and get them into the appropriate sections and places that they need to be.
When I'm in my practicum site, seeing my student getting something correct and seeing how happy she is, that's the best feeling because I'm doing my job right and I'm making a difference.
I think one of the greatest pleasures is when I have a child who's having difficulty learning to read, and we help that child crack the code and put it all together, and then that child sits down and reads a book. I find that part rewarding and exciting.
Maybe you prefer a more data-driven approach. You'd like to help clients with disorders like autism or ADHD overcome problem behaviors or skill deficits using a lot of one-on-one therapy. You are more focused on helping people change behaviors rather than their thoughts and feelings. If so, applied behavior analysis is a good choice.
I think a good fit for behavior analysis is a person who really wants to help people and really likes that science behind the behavior and how we can improve it.
I got my current job, which is working at Eden Autism Services performing direct care. I want to learn more about the approach that we currently use to shaping their behaviors, evaluate their behaviors. So that's why I decided to come back to Rider to complete my master's program.
Good boy, nice job counting.
I work with individuals with autism. There's a lot of things that you can do with ABA. It allows you to work in the private school setting, public school settings, corporate world, you want to go into government. There's a lot of career opportunities which you can actually go into.
When you can sort of analyze a situation and put interventions into place and change socially significant behavior for these individuals, they become more independent. They're able to do things that they weren't able to do before. And I think that's what makes it so exciting.
Maybe you take a more holistic view. You're empathetic and non-judgmental. You prefer a traditional counseling approach, listening to a client's thoughts and feelings. If so, clinical mental health counseling could be the right career for you.
I decided to go into the clinical mental health counseling program because I was always the friend who people went to for advice or they went to just talk about their problems. And that's what I found the counseling program was. You are sitting face to face with a client and trying to help them through their problems, ultimately ending up helping people and making people's lives better. And that's the goal that I want to achieve.
There's a lot of different job opportunities. That's kind of one of the nice parts of the degree because different organizations and agencies employ clinical mental health counselors. I always feel honored when I'm working with a client in terms of being part of their story. Sometimes clients will tell you things that they don't tell anyone else. So I think it's rewarding as a clinical mental health counselor to create that safe space clients can come to and feel completely accepted. I think that's a really valuable thing that people don't get in many other places in their life, but the counseling office can be a place where they get that.
The options in counseling and psychology can be confusing, but the right career for you is out there. If you have questions about any of these careers or programs, please visit Ryder's website at the URL below or call us at 609-896-5036.